Hello, 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 hello. Welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, family nurse practitioner, content creator, and a community volunteer. Today we're going to be talking about stroke awareness. May is Stroke Awareness Month, and today I'm going to go my disclaimer first. Again, as I always say, whatever we say here, whatever we talk about today or previously, should not take the place of you going to see your doctor, and do not change any of your medical regimens without seeing your family doctor or provider. Okay, so we're going to be talking about stroke awareness. It's important. When I always give my statistics, I'm going to go into that. Let me start there. If I'm looking down, I'm just looking at my notes. Okay, so I'm going to introduce you in a second. Okay, so alrighty. So today we'll be having a discussion on stroke awareness, about the stats and symptoms, treatment and prevention. As with any major illness, it requires a multidisciplinary team for an effective outcome, and more importantly, even with stroke, it requires a multidisciplinary team. Like I said, one important member of that multidisciplinary team is the stroke coordinator. So ATHL, please give a rousy welcome to Julie Recca, my former coworker and stroke coordinator. So Julie, would you please introduce yourself and just tell a little bit about yourself and why your position is important?
Hi, my name is Julie Recca. I'm a registered nurse and I work as a stroke coordinator. Sorry, I'm being weird with adjusting my phone.
Okay, that's okay.
I'm doing this. So as a stroke coordinator, I oversee and look at all the data from patients who have strokes to make sure that we're doing everything we can to promote the best care for a patient. So we're looking at from when the patient comes through the door of the emergency room to when they're discharged, to make sure that A through Z was addressed and that the patient had every test, lab, consult, therapy, treatment that they were supposed to in a timely manner, so that everything was addressed, that nothing was missed during their length of stay in the hospital. Um, and we're doing this for safety of the patient to, because when we're talking about stroke, we want to prevent any sort of lasting effects of the stroke and prevent any sort of disabilities from a stroke, or reduce as much as we can.
Okay. Alrighty, so I'm just going to go over some stats here. Thank you for coming on, Julie. I really appreciate
You're
it.
welcome.
So we'll go some of the stats. In 2018, stroke accounted for 1 out of every 19 deaths in the United States. On average, it was someone died of a stroke every 3 minutes. Stroke is considered the number of the fifth leading cause of death in the U.S. In 2018, it accounted for over 147,000 stroke deaths in the U.S. I'm reading from my phone today, people. So, anyways, so according to the data from 2005, stroke was the leading cause of serious long-term disability in the United States. In 2019, there were 6.6 million deaths attributed to cerebrovascular disease worldwide. Okay, so we're going to start talking about, I've talked about the stats. So I usually tell people that when I read at the stats, and even that with human nature, we're going to be like, oh, well, that many thousand, this many thousand, that's just them. Those are the people, I don't know them. That's not going to happen to me. But I always say, in real life, at least 3 people who have had a stroke, and you also, one of those people are related to you. One of those people related to you, meaning genetically, not like if you're the husband and the wife, because people get that confused. Yeah, no, my cousin and my husband's side, no, people who you're genetically related to. So that puts you at a higher. That's one of your risk factors. When you have somebody who has had a stroke, especially like a first degree relative, your mother, father, siblings, and sometimes your grandparents too. So the first thing we're going to start off with today is talking about the symptoms. Okay, as a family nurse practitioner, I take care of the prevention part, and I also take care of the follow-up and all. So we will be talking, Julie works in the hospital, so but she'll be talking about the symptoms and all that, and then we'll go over with the risk factors and prevention and all. So Julie, let's talk about the symptoms when somebody's having a stroke.
Okay, so we have a little saying called "be fast." So it's important to recognize what the signs of a stroke are, so that you know to call 911 or activate your local emergency response as quickly as possible, so you can get treatment as quickly as possible. So there's a little saying called B fast. So B would stand for balance. Any sort of issues with dizziness, balance, loss of coordination, severe sudden headache, you want to call and activate emergency response. E would stand for eyes. So any visual changes, loss of vision, blurry vision, double vision, even if it's just one eye. F stands for face. If you have a facial droop, meaning half the face is drooping, it's, like not just by the mouth, but by the nose or the eye, all of a sudden they can't move that side of their face. They're having trouble moving. The muscles are paralyzed, or there's numbness or loss of sensation on the side of the face. That stands for F. A is arm. Any weakness, sudden weakness in the arm or the leg. Trouble moving that arm, feels heavy, hard to lift, hard to grip or hold an object. That can be a sign of a stroke. And then S stands for speech. So trouble speaking or swallowing, that can be a sign of a stroke. Or all of a sudden you notice that a person has a confused speech pattern where they're not making sense. They're trying to talk, but there's the sentences that are coming out aren't making any sort of sense. It's almost like a rambling speech. That can be a sign of a stroke. Any one of those factors, T, you want to call, and I'm used to saying call 911, but activate your local emergency response. So T stands for time. Time is of the essence. When we talk about a stroke, we only have 3 to 4.5 hours from when the symptoms first start in order to implement certain treatment. After that, the blood flow has been cut off to the part of the brain where the stroke is occurring too long, and there's not much we can do to reverse the stroke at that point. Before that, there's either medication or surgery they can do to treat the stroke, but after that point, it would cause more damage to go in than it would to leave the stroke where it's at. So that's something. The time is the most important thing, to get to the hospital as soon as possible to get treatment. Studies have shown the quicker you get treatment, the quicker someone may recover from a stroke and have less disability from the stroke. Because when we're talking about strokes, we're always worried about disability. How is this going to affect this person in their day-to-day living? And are they going to have things that they're going to have to struggle with in order to live their life every day now? And that's what we mean when we talk about disability.
Okay, and it's even more important when I tell people is your life or your livelihood, because if a parent has a stroke and you're one of the people who work in the household, that can severely, that income that is no longer there, and it changes the entire lifestyle of your children and everything. That can affect how you pay your bills, your mortgage, and everything. So it's very important that if you start having any of those symptoms, and you want to get to the hospital as soon as possible. And also if somebody finds you, you also want to remember, I think was the well time was the last time you saw them
Yeah.
when they had their regular capabilities. So they also want to make sure that it's not over the 3 hour period. So once you speak to that.
Yeah, so that is something they will ask you when you come into the hospital is, when did these symptoms start? When did this begin? Because the doctor needs to know, was it 5 minutes ago, 5 hours ago, 5 days ago? Because that is going to make a difference in how they treat the stroke and what they are capable of doing
Okay.
to
So
treat.
when they get to the hospital, they have first one of the main tests that they do, besides the vital signs and everything, you have to get into the CAT scan, which is, you can tell about that
Oh,
imaging to make sure there's any. You can just mention that a little
yeah,
bit, just
come in the hospital,
briefly.
they're going to grab your vital signs, establish an IV. They're going to check your blood sugar, and they're going to do a CAT scan of the brain, because we want to, when you're coming through the door, there are two kinds of strokes. There is one caused by a clot that's blocking blood flow in the brain. The other kind is a bleed, meaning a blood vessel ruptured and it caused a hemorrhage. We want to see what kind of stroke it was, number one. And number two, we're evaluating to see if we can give medicine to dissolve a blood clot. So with the CAT scan of the brain, it'll tell us whether you had a hemorrhage or not a hemorrhage. So we want to make sure there is no hemorrhage. So we're going to do a CAT scan of the brain, see that there is no hemorrhage. If there's no hemorrhage, then we can see if we can give medicine to dissolve the clot, because then we know it's the other type of stroke.
Okay. Alrighty. And the part that you play now, when the patient has had they had the CAT scan and they found that the patient had a stroke and they've already started emergency medicine. So just give it like maybe a few minutes of like the hospital stay. What would happen in the hospital stay before they go home to make sure that they
Oh,
don't have to come back for any, and like we'll try to prevent readmission and make sure we go for a healthy outcome.
okay. So with a stroke, we're going to try to implement treatment as soon as possible. So we're going to give medicine to thin the blood to prevent any further blood clots from forming. So they're going to start with a baby aspirin. They may add an additional type of antiplatelet medication. It could, and that type varies, but they are going to give you medication that causes your platelets, which are the blood cells in your body that tend to stick together and form clots. It's going to cause them to be less sticky. So it'll take longer for your body to clot, because we want to slow down that clotting process. They're going to do lab work and check and see what are your risk factors for having the stroke. So if your blood pressure is high, we're going to treat the blood pressure. If your cholesterol was high, we're going to give you medicine for the cholesterol. If your blood sugar they'll do a hemoglobin A1C, which is a lab that'll tell us what your blood sugar is over a 3 to 4 month period. If that is high, they're going to treat that. So we're looking at what are the risk factors that may have caused the stroke. If you're a cigarette smoker, we're going to talk to you about quitting. If you're an alcohol drinker, we're going to talk to you about quitting. If you're using other drugs like cocaine or methamphetamines, we're going to talk to you about stopping those, because those put you at risk for having a stroke. If you're overweight, we're going to talk with you about diet and weight reduction, and implementing an exercise program. They're going to probably have a physical therapist, an occupational therapist see you. You might have a nutritionist or a speech therapist see you, because we're going to check
Depending
and
on depending on the residual from the stroke or whatever
yeah,
part of your brain that is damaged that causes a residual effect, meaning that the part of your brain that's damaged, if it affects your ability to chew and swallows
right.
carefully, you have a speech therapist to come and help you recover from there and all that.
Yeah. And the nurse will do a full evaluation, a neurologic evaluation of you, and so will the neurologist, to
Mhm.
see how did the stroke affect you. Did it affect your eyesight, your ability to swallow, your ability to move your arms and legs and walk normal? Are you having dizziness is stopping you from walking? So they're going to check your coordination. So they're going to do a head to toe assessment. They may ask you to get up and walk a little bit to see how you're walking. And then based on that, they'll start whatever therapy you need. Because the quicker we start these therapies, the quicker we can help the body recover from any damage done by the stroke.
Okay. And so you just name all the different multidisciplinary team members and all that. What if the patient decides that, okay, if it calls for the patient needs to go for short-term rehab, or sometimes they have to go for long-term rehab, how do you approach that with the family members? Because some people don't like that.
Yeah, well, that is based off what physical and occupational therapies recommendations are,
Mhm.
and what kind of support system the patient has at home. So that's when social work and case management get involved too, with the patient and their significant other, family, children, whatnot, their family, to see what is the best course for that patient. Some people want to go to therapy, some people want to go home with home physical therapy, and it really depends how safe the patient is now post stroke. Because how did that stroke affect you? Are you able to think the same as you were before the stroke? Are you able to eat the same as you were before the stroke? Are you able to see the same? Are you able to move your arms and legs the same? Are you now having seizures that you weren't before the stroke? So, what is the safety of the patient, and what is the safest thing for you to be at? Because if you're not able to walk by yourself, you're not able to eat by yourself, it's probably not best for you to go home by yourself. So, we want to make sure there's some sort of support network in place for the patient, and they may need short-term support, which would be a short-term rehab, an acute rehab, till they're able to recover enough to go home by themselves, or they may need something longer, a little bit more time. So that really depends on all these different therapist notes stating how the patient's progress throughout their hospital stay, and what is the safest decision for the patient, because that's what we're ultimately worried about, is what is the safety of the patient, how safe are they when they're discharged from the hospital.
Okay, and other important members too of the health team will be the social workers. If you need spiritual care, because we have to make sure we're taking care of the patient, mind, body, and soul, and also your CNAs that work in the hospital as well. They're all of
Yeah,
that. All those people are going to be working closely with you to make sure that your outcome is where we need it to be, so you don't have to come back into the hospital for reasons that could have been prevented.
right,
Okay.
right.
All right. So now we're gonna go into risk factors. You kind of mentioned some things in there which will be part of the discharge instructions, but we're
Sorry.
gonna mention some of the risk factors. So you want to go ahead and then
Okay.
I
Yeah.
can add to
So
that.
when we talk about risk factors for stroke, we talk about modifiable versus non-modifiable. Non-modifiable means things we can't change. We can't change what sex we're born. What we can't change our age. We can't change if we had a stroke in the past. We can't change hereditary, what we inherited from mom or dad biologically. We can't change if there's some sort of coronary artery disease or pre-existing blood clotting condition. So we're going to look at those factors and what put the person at risk for having a stroke. And then we're going to look at what risk factors we can change. Because if somebody's blood pressure is high, we can work on giving medication to lower the blood pressure, talk about a diet that helps lower the blood pressure. If the cholesterol is high, we can give medication. We can talk about diet changes to lower the cholesterol. If they're diabetic, we can talk about implementing, once again, diet and medication to help better control the
The
blood sugar.
A1C, and I did a
Um,
show on diabetic awareness, diabetes awareness. You guys can go back and look into that as well. So just putting that part in there.
um, if you smoke cigarettes, you can quit, because that cigarette smoking is a big risk factor. Drinking alcohol, even like people who think that one drink a day does increase your risk slightly, let alone if you're having four or more, it drastically increases your risk. Excess weight, lack of exercise. These are all things we can work to change. So we focus on what behaviors can we change to reduce that risk of a stroke happening again. Because once you do have a stroke, there is always a risk of it reoccurring. So we want to reduce that risk as much as possible.
Some of the other risk factors to the non-modifiable, we're talking about if you pregnancy is a risk factor too, because that the high demand, the body's high demand for extra circulation and blood and all that, that can also put you at a risk for stroke. So those are things so that when you go to your OBGYN every time for every visit, they do your weight and they also do your blood pressure and all that to make sure that you are progressing healthy. Otherwise, sometimes when I did my clinical rotation, we had to start some people on blood pressure medication because it was so high. We had to see them more often because the risk of having a stroke when you're pregnant, which can be very devastating if you have a stroke when you're pregnant. So those are another factors where basically we will. And if you do have issues with high blood pressure too, for further future pregnancies, they do tell you, okay, now you have you're going to be high risk factor, high risk pregnancy every time you get pregnant next time. Doesn't necessarily mean that anything else, but they just tell you based on your history that you have at a higher risk and you may have to see another specialist outside of just the OBGYN as well to progress through the pregnancy safely. So those are things. Also some cancers too, because your blood clot, I'm not sure whether you mentioned that, the
Right.
clotting factor and all of that too, all the autoimmune diseases. Some autoimmune diseases can also put you at a risk for having a stroke. So those are things that basically you can change, but you got to make sure that you follow up with your doctor's appointments. Have to be very compliant with all the medications that you're taking. And because there's nothing else you can do when you have the autoimmune disease. That's just something that you have to live with, but you can live with it in a way where as long as you're complying with your medical regimen, you shouldn't have a problem or you shouldn't have any issues that you can suffer major complications from. So
Another risk factor we're seeing is COVID, because
yes,
COVID does cause this hypercoagulability state.
yes,
So
yes,
we're seeing increased heart attacks and strokes from having COVID. So get your vaccinations.
yes. And I mean, also people who have irregular heartbeats too. When you're taking medication, that's supposed to regulate their heartbeat because when you have atrial fibrillation and all those things, and if you're not compliant with this medication because you come from a heart disease point of view, that can also put you because they all fall into the cardiovascular risk factors there. So those are things that you really have to pay attention to. Okay. So that we went through that in this order. We did that and stroke history. If you had a stroke
Yeah.
before, that always puts you at a higher risk of having another stroke. So you speak to that too,
Yeah. And
because go ahead.
TIA, big one too. People who've had these little mini strokes, a lot of times they can be warning of a stroke to come. So a lot of times we'll do stroke education with people who didn't necessarily have a stroke. They had what they call a transient ischemic attack, which is like a mini stroke. And it just means the blood perfusion through the brain was a little sluggish for a short time. It wasn't a full stoppage of blood flow. But it can be a warning sign of a stroke to come. So if you had one of those or know someone had one of those, that's a pretty big warning sign to change your behavior to prevent a stroke from coming on later.
And to make it more culturally relevant, I'm Liberian by birth. I
Mm-hmm.
always tell my Liberian patients, and a lot of people who even now in Liberia, but anybody who eats food that like rice, we eat rice. Rice is our staple. So
Okay.
it's like the same thing as if you're eating pasta and all those things, everything that have like heavy carbs and
Mm-hmm.
sugar, and also you want to make sure you cut back and that you can have brown rice. And people are like, oh my God, I can't eat brown rice. It took me a while to get used to brown rice myself. So
Yeah.
I know I have stroke in my family, high blood pressure in my family too. So as I get older, the chances of me getting to that point, and so I'm trying my best to make sure that that doesn't happen to me. But if I see myself going that way, I go to my doctors every year. I try my best to go to my doctor every year. We healthcare people, we're so busy taking care of
Yeah.
everybody else, and we
About our,
forget to take care of ourselves. So I make sure I look at my blood count every year and see where my cholesterol levels are, where my A1C is, and all that, and making sure that I try to, for the past couple of months, I've been trying to go back into my walking because you couldn't go to the gym with everything else that was going on. So I tried to do that. So it's important that cut back on your rice. I tell my patients that too. Cut back on your rice. Cut back. You can eat brown rice. You can eat. I think anything white is bad. White
yeah.
bread,
Yeah.
wheat.
I was saying white, right.
Yes.
Yeah.
Yeah. So it's like wheat bread. And sometimes I like, oh my God, I know what my husband's like, oh yeah, Abby Tyler's healthy living. I hope your people be looking at you even
Yeah.
when I go to parties, I tell people somebody like they saw me at a party, like, I'm just watching you. She better eat the salad
Yeah.
first. She better eat the salad first. She tells us to eat healthy. She better eat it first. So,
Yeah.
so it's like you make sure that something that we're used to, because once your body, you've been eating after the time you're smaller or younger, and
Right.
your body's used to that, and you come into this different culture and they tell you, oh, you can't eat that is bad, you don't eat that's bad. We're not telling you that it's bad. You can modify it, you can eat it different, like less palm oil, less salt, and we season our food to perfection,
Right.
that.
And you can still use all the other seasonings. It's just the salt you want to cut back on.
Yes,
So you
yes.
want to use heart healthy oils like avocado oil, olive oil. You want to watch out for the palm oil and the coconut oil and the butter because those tend to be high in saturated fats. Lots of vegetables are a wonderful thing. Beans are great. When you're eating your carbohydrates, you want to look at things that are higher in fiber. Fiber will naturally help lower your cholesterol and it'll help stabilize your blood sugar. So, because when there's higher fiber, it slows down the
It
digestion,
goes good.
so it time releases. So
Yes.
you want to eat, brown, like wheat bread instead of white bread, brown rice instead of white rice, because it's a higher fiber content.
Yes.
Vegetables and fruits are naturally high in those fibers. And we talk about lean proteins in America here. A big thing is processed meats. A lot of people are eating a lot of those lunch meat, hot dogs, bacon, ham, sausage. You really want to cut that stuff out. You want to stick to healthier, fresh meats, chicken, fish, turkey, meat that you cooked yourself. And I always tell people you can still season, you can still use tons of herbs and spices and pepper and garlic and whatnot, just not the salt. Watch,
Yes.
just go easy on the salt because the salt makes our blood pressure high. It makes you get swollen. It retains fluid in the body. So you really want to go easy on the salt when you're cooking.
And we do season salt, and then we do salt, and then we do another season. So we
Yeah.
make it in a way. What if
Yeah.
you somebody invites you over and you can have some nice Liberian food? They have a restaurant in Philly there off Frankfurt Avenue too, so you can go there and
Yeah.
check it out. So it's nice and seasoned, tastes good, but
Yeah. Yes.
So I tell people it tastes good, but it seems like you can still make it good. But you can, as you get
Yeah.
older, and when you need to start early, because now I'm doing blood work on the younger people that are coming in to see
Mhm.
me, and the cholesterol level is already high, or the
Yeah.
A1C is already high, and I'm trying now. It's like you're too young. I don't want to start you in anything yet. Okay, because I want you. You can do this. Oh, always when people say, "Oh, you all you want to do is put people on medication." I said, "No, no, no. You're giving you time to make sure that you exercise and stay active and all that, to try to delay as much as possible. Because
Yeah.
once you start a medication, and if people think, well, once I'm taking a medication, I can still do what I
It's
want
not.
to do now. No, that's
Yeah.
not what it's supposed to be like.
Yeah. And exercise helps naturally lower your blood pressure and your cholesterol also. And we talk about starting with gentle, moderate, consistent exercise. So take a little walk or a bike ride or go swimming, 3 times a week for 10 minutes and slowly build up your tolerance. So you're doing 15, then 20, then maybe 4 days a week, slowly build it up. You don't have to go crazy and do all these crazy aerobic, Zumba, whatever. You can slowly ease into it, gentle, consistent exercise that gets the circulation going and gets your heart pumping, you
Okay.
know?
Okay, so when we talked about the fact. Okay, so now we're gonna get into we did genetics, yes. Okay, so we did modify and non-modifiable. So when they're discharged now, you tell them how explain to them how important it is to follow up with their family doctor.
Extremely important. You really want to continue that transition of care where you're still having somebody that you can go to because you're going to have questions. You want to make sure that your blood pressure is still staying good now that you're back in your home environment, now that you're back to your everyday life stressors. Now that you may go back to work, you may be back around your family and family issues. You're back to, hopefully you're keeping a good diet, but that's going to be a transition to make. So you want somebody that you can go and see at least within a week of getting out of the hospital, that they can check your blood pressure, make sure it's staying good. And now that if you've been started on this new medication for your cholesterol or for your blood sugar, that they can recheck your cholesterol and your hemoglobin A1C within 3 months time to make sure the medication is working and the diet is working and it is coming down and not either not going up or staying the same. Because if you are doing what you're supposed to do and you are watching your diet, you are taking the medication, then we should see those levels come down. And if they're not, that means a second, something needs to be changed and addressed. And that's where your family doctor comes in, because you want to make sure you have somebody there checking on you and checking on your health. Hospitals should only be for emergencies, not for the maintenance of your everyday care. That's what your family doctor is for, to make sure you have somebody that you're checking in with every couple months to once a year to make sure that everything's working good for you. And if
Mhm.
not, they can address these problems before it gets to the point that you end up in the hospital, you know?
Okay. Yes. And then when they do come to me, like you said, I read the discharge. Can you please send a discharge summary too? Because sometimes we don't get a discharge summary, but I think we're changing our EHR now. So I before we used to print out a whole discharge summary and it was like 10,000 pages.
Yeah.
So, but sometimes it's like then I go over there, but we can go into the system and read the discharge summary to see exactly what you guys did. And sometimes because the patient, when we're doing the discharge instructions, they're leaving, they're not really listening completely. So when they
Mhm.
do come to me, I have to read it in depth and see everything. Okay, they also want you to follow with the neurologist. They also want to, you may have to follow up with the cardiologist and other different multidisciplinary members too, and
Yeah.
social workers too, because you may be having home care aides to come to your house or home care nurses to come over to your house. So
Right.
all of that, we coordinate all that. You bring everything from the hospital, and I coordinate all that. And at the same time, too, when you come to me, we're also doing the medication reconciliation, because they may have been medications that you were taking before that it put you in the hospital. And sometimes the patients come to me like, "Am I still supposed to be taking this other medication? Why did it stop me? They stop this medication?" And this doctor said I can continue taking that. So then we have to coordinate all of that to make sure that you are safe after you've gone home, that you're taking the right medication at the right dosage, and also when to follow up with me to do, like you said, continuity of care, and also the testing that we have to do, because we usually have our patients come back in. Sometimes they may have to come back in 1 month later because the blood pressure still remains high, and I have to regulate that medication as well. And sometimes I may say, okay, then I want you to follow with cardiology and all that. I used to follow with neurology. What symptoms are you having? Sometimes we cannot. You may have to stop driving for a while until you're cleared by neurology.
or if you had seizures
If you have
post-stroke.
seizures, you have, yeah, and sometimes they get mad at like, okay, that was a while back. You have to be seizure free for about a year before you can start. And you have to be cleared by neurology. I can
Yeah,
write everything and I say if cleared by neurology, and sometimes patient gets up, they get upset thinking that I say no, by law you have to be seen by a specialist for them to clear you.
yeah,
So that's some of the things when you think about. So basically, what we're saying is like you can see how devastating having a stroke can be, how life changing they can be. So it's very important that knowing your risk factors. Most important things too, we always say, know your numbers, your weight, your cholesterol, your A1C, your blood pressure. You have to know those numbers and keep an eye on them at all times. Last time I was here, we can give you a printout. This is where you were last time. I would turn my computer to the patient and say, this is where you were last time around. This is where you are now. And I also ask them too, have you had anybody else since you were here last? Anybody had a stroke? Anybody else had anything? So that way I know I'm updating the chart. So I'm making sure that I'm keeping up with their risk factors as time go on. Because now I'm taking care of family members who I see the whole family. I seen
right.
family. I'm like taking care of this family. I took care of the mother, the father, the grandmother, and now I'm taking care of the two, the younger daughters. And also I feel privileged to be able to be in that position that they trust me enough to do it, because where I work, I'm like the main provider there. So I'm going through that. But even for our Liberian community also. And like I said, for my own family, I have stroke in my family. So I'm always like, okay, and I really think about it. And being in health field, I'm always thinking, oh my God, I'm having a stroke. You know how we think everything, whatever we read about, that's what we have. Remember that from nursing school. So it's important. So I know any final words you want to say before we get off, and then I'll look and see what the comments are saying there.
Okay. No, I mean, thank you for listening. I'm just going to say, remember, be fast. Balance eyes, face, arms, speech, time.
Yes.
Know signs and symptoms, know to recognize them in yourself and your family members. I think it's important everyone knows to recognize those signs and symptoms of a stroke, so you know when to call for emergency medical team to come and take you to the hospital immediately, because time is brain. The longer
Yes.
you wait, the more
Yes.
brain you can lose. So the
Yep.
quicker
That's it.
you get
That's it.
there, the quicker your recovery can be and the less damage the stroke can do.
Yes. Yes.
Um,
So let me just look and see if there's any questions there, comments. I'll open this up and I'll see. My friend Masada, but she said welcome. So my people are like, they say welcome, Julie. So, and then another person said important topic. Yes, it is. Yes, it is. Because I mean, it's like devastating in our community, and also your race. When African Americans have a higher chance of getting that. I mean, there's not like a pinpoint a reason for that, but mainly because
Yes, I mean, there's the sickle cell factor, but some of it may be socioeconomic based. Also, some of it may be related to high blood pressure. Um, African Americans tend to have higher rates of high blood pressure, which is a big risk factor for stroke.
yes, and also when you talk about in the inner cities and all that, because a lot of food deserts, whereas most places
Yeah,
don't have supermarkets, and most
yeah,
people go shopping at the local store down the street, which is mainly just like a convenience store, and they buy like canned foods and all those different things that are not healthy.
yeah,
So that's why when people say, "Oh, everything is like black people and black people and black people," but I'm meaning I started this forum also to make sure like I'm teaching everybody, but I
right.
also try to make it culturally relevant so people can see that,
Absolutely.
okay,
Yeah,
so that at least that way you can say, okay, there's somebody who looks like me and telling me these things and all that. And hopefully we get to that. And especially my people, it's like, because I come from a culture where the healthcare system is not that great over there. So most of the times, like we try to get certain things in because that it's long story anyway. So,
I'm not
but
as well.
but you will have some Liberian patients. I've had some Liberian patients in Nazareth before, and I told them certain things, and they're like, "Okay, don't bring that American thing to me." I'm like, "Oh no, I'm just trying to keep you healthy." Okay, so. And it's hard. I mean, anybody adjusting to different things, especially the older you are, trying to adjust to something that's not part of what you're used to. It's hard.
Yeah, it
It's hard.
is. Help people take one thing at a time. I said,
Yes.
it's a lot of change. So I said, take it one day at a time. Like when you first get home, get your medication sorted. Figure out what your medication is. If you need to get yourself a pill box so you know that you're taking your morning and nighttime medicines, make sure get yourself in a habit of taking those medicines. Then you can start to look at diet and start little subtle changes like, okay, every day for breakfast I'm going to eat something healthy instead of having bacon and whatever, have some oatmeal and, some egg whites, or, so maybe the next week worry about lunch, having a salad, next week we can work on dinner. Like, let's make these slow changes. Start to, by week 2, like maybe the first week you get up and do a little walk around your living room every hour. Maybe week 2, you'll do the length of the house. Maybe week 3, you'll start to take a walk outside, go up 3 houses and back. Maybe by the next, you'll want to do half the block or the whole block. Slowly build up and incorporate it. Because if you do everything at once, it becomes unmanageable and overwhelming so easily.
Yes.
So little steps at a time, slowly add things in and incorporate things in bit by bit. And over time, it will become habit. They said, I think it's, if you do something for 3 weeks consistently, it starts to become habit.
Yes.
So that's, start to slowly make these new habits. It just
And
takes.
also, and yes, and it's important. It's important too to make it a family affair, because
Yeah.
like I always tell people, I'm not going to just sit in there eating salad while you sitting there eating chicken.
Right.
So
Yeah.
try to make it seem like, okay, try to make it, no, we all can just eat completely healthy, but try to make it, okay, this is what we're going to be incorporating different things, and we're all going to try to do it together.
Right.
So that way everybody becomes healthy, and this person doesn't even have pressure enough to, like, the temptation is not there to want to eat something different, because I'm not going to eat something then when everybody else is eating something much better. So make it a family affair.
Yeah.
Okay. So I'm probably going to have to have you on for a little bit more topic. It's been really nice having you here, and the internet actually behaved. I hope, because sometimes when I watch it later on, it's like, okay, but thank you so much for taking my invitation, because I wanted to do this topic, and I'm like, oh, I'm going to see if I approach her. I don't know, so it's like, that's right forever. So thank you so much, Julie. Thank you so much. Thank you so much for coming on. And for everybody else, thank you for watching. For those who join us during the broadcast, I say thank you. For those of you who will be watching later, I say thank you as well. If you have any additional questions, I'm going to put a video out there where it says the fast. So a TikTok video where I'm going to put in the comment section so people can look at it and kind of remember that. And also I can put some pictures up to in the comment section where people can refer to.
And American Stroke Association website, they have numerous amount of information on it. Stroke support group information, recipes, articles, all kinds of different links to different, activities and tips and advice and information. It's a plethora of information about stroke.
And so just go to America Stroke. What was it again?
American Stroke Association.
Okay, so they can just go in there, and then I can probably type that link into there too. Okay, so we got that done in a considerable amount of time there. Thank you so much. I know you're busy, you had a long day. I did too, but thank you again for coming on. And whenever you have any important topic you want to talk about or anything else, we can come on. Maybe I can get your sister on, and we can talk about it. Get the whole family on, and we can, she's a dietitian, like nurses and dietitian, and be like, going to nursing school and trying to learn all these different calories. And like, do we need to know this? We have a dietitian. She's a dietitian nutritionist, right? I think. What is it?
Dietitian.
Okay. All right. Tell her I say hi, and hi to your mom and your nieces.
Yeah.
Right. Okay. It's like I know the whole family. All right. Thank you, Julie. See you later. Okay. Thank you so much. All right, everybody. Good night. Thanks for watching.
You too. And thank you for watching. Bye.